So today what we are going to do is we are going to kind of talk about what you refer to as RIRS. Now, what is this RIRS? RIRS is retrograde intrarenal stone surgery. Okay, so we talked about what you call as a ureteric stone a bit. Okay, so we talked about the evaluation of a patient with the ureteric colic and the renal colic. In that, very briefly, I talked about the management of the patients with the kind of stone, like what procedure we do for what, like PCN is done for what, UR is done for what. So when do you do an RIRS? Can you tell me? Okay, so if at all you are live, okay, you can tell me. Otherwise, it's fine. So if you're watching this in the recorded kind of thing, when are you going to perform an RIRS, retrograde intrarenal stone surgery? Okay, now if at all you have a kidney, obviously, and if at all there is a stone in the kidney which is present inside the kidney, okay, and the stone is less than 2 centimeters in size. Okay, less than 2 centimeters size. What we perform is RIRS, retrograde intrarenal stone surgery. Okay, now if at all you are working in a general surgery department where you have never ever seen this particular procedure, it will be a bit difficult for you to appreciate what I'm trying to say, but I'll try my level best to kind of make it simplified for you. Okay, so let's talk about this RIRS. What is this retrograde intrarenal stone surgery? Okay, what exactly is this? In this, what you basically do is that, okay, so let's start. So a 32-year-old male patient with the dull-aching pain in the left flank since 2 to 3 years. So the patient is having a dull-aching pain in the left flank for like 2 to 3 years. Okay, now there is no history of the fever, no history of hematuria, dysuria is present. That's fine. What would be the next step? Okay, what would you do as a next step in this particular patient? Just 1 minute. I think my screen was not visible. Now I think it's visible. Okay, okay. So what are you going to do as a next step? Okay. Uh, Good to have you back, Vikesh. Right. Uh, so coming back. Okay. So you have a patient like this. Okay. Now, what is going to be a next step? If at all there is a 32-year-old male patient, they're lacking pain in the left flank since 2 to 3 days, no fever, no hematuria, dysuria present. What are you going to do? Vikesh, can you tell me what will be the next step in the management of this patient? Okay, so what you can do is you can get an X-ray KOP done. Okay, that's fine. That's what is a basic investigation which we usually get in. Okay, it's you are not finding any particular thing in that. It's quite nominal. So how many percentage of the stones can be detected on an X-ray KOP? X-ray KOP can detect only 80% of the stones. Okay, 20% of the stones are undetected. You're not able to detect 20% of the stones. I hope you're able to appreciate this. Okay. Only 80% of the stones are detected on the X-ray KOP. 20% of stones you're not able to detect. That's what you need to understand. Now, you did an ultrasound KOP, which showed that there is a 1 centimeter stone in the left middle calyx. Okay, so in the kidney, we have a upper calyx, middle calyx, lower calyx. What we had was we had a 1 centimeter stone in the left middle calyx. You did a NCCT KOB. Why? Because this is what is an investigation of choice. Whenever you have any suspicious stone on an ultrasound, always get a non-contrast CT scan done. NCCT KOB has to be done. Okay, NCCT KOB has to be done. NCCT KOB, what did it show? It showed that there is a 1.2 centimeter stone in the left middle calyx. Okay, so similar. NCCT basically is able to tell you the exact size, and it is also able to tell you about the what you call as a composition in the form of Hounsfield unit. Okay, how much is the Hounsfield unit? It is like a very dense stone or a very brittle stone or something like that. These particular things you get to know on the CT scan, right? That's what you need to understand. Rest was normal. It means that there was no fever, the counts were normal and everything. So what is going to be the next, like how are you going to manage this particular patient? Anybody? Vikesh, can you unmute yourself? Let's interact a bit. How are you going to manage these particular patients? So in these particular patients, what you have to perform is something which is called as an RIRS. The management of this particular patient is in RIRS. Now, let's kind of talk about that. So you did a urine routine. Okay, there was 6 to 8 like WBCs per hair per feet, and the urine culture showed no growth. Well, this is fine. The management is going to be the RIRS. Now let's talk about this. What is an RIRS? Okay, so this is what is the scenario, right? This is what is the scenario. Now, what are you going to do in this particular patient is, okay. Now, if I ask you that for the RIRS, would you need a rigid scope or would you need a flexible scope? Obviously, you will need a flexible scope. Why? Because you want to reach till the stone. For the ureteric stones, we can use a semi-rigid. Okay, so for the ureter, for the procedure which is called as a URS, what we have is a semi-rigid scope. Okay, what we have is semi-rigid scope. Okay, you understand my point? But over here, if at all there's a stone inside the kidney, what we have is a flexible stone. Okay, so what we use is the flexible scope. Now, what you basically do in this, you did is to do a cystoscopy. Okay, so what are the equipments needed for the RIRS procedure? What do you need? You need a cystoscope. Have you ever seen a cystoscope? So just like in the laparoscope, you have a kind of a camera, right, with which you kind of go and watch inside the abdomen. In the similarly, the procedure in which you put a scope inside the bladder and then you visualize inside the bladder. That is what is referred to as a cystoscope. So here what you're doing is you're doing a scopy and you're basically looking inside the urinary bladder. So this is what is called as a cystoscopy. Okay, what is a cystoscopy? You're putting a camera inside the urinary bladder and you're visualizing the urinary bladder. That is what is called as a cystoscopy. You understand my point? Now, once you go and once you enter inside the bladder, what you basically see is you basically see that there is ureteric orifices. Okay, so let's come back. What you basically see is you find that there is ureteric orifice. Now, what you need to do is you need to pass a guide wire through this kind of cystoscope, and that guide wire is going to enter into this ureter, and it is going to go and enter inside the kidney. You understand my point? So it is going to go from the ureter, and it is going to enter inside the kidney. Okay. Now, for that, you need a ureteric catheter and a guide wire. Why are you okay? Ureteric catheter, what is it? Ureteric catheter, it is nothing. It's a 6 French long catheter. Green, usually it is green colored. It can be of any color, that's fine. It's a 6 French catheter, which will help your guide wire enter into the ureteric orifice. Okay. What is a guide wire? So what we use, okay, so when I was a urologist, like when I was a surgical resident, there was a urologist. We did not have a full-blown urological department, but occasionally the urologist used to come to the hospital and they used to kind of operate a couple of cases. And as a first year, they always used to ask for something which is called as a Teremo guide wire. Have you ever heard of Teremo guide wire? Okay, so what is this? This is the one which is having the flexible tip. And this is the only thing which we use. So this is having a flexible tip and this is hydrophilic. Okay, so sorry, this is what you need to understand, that it basically glides. Okay, so it basically glides. It is basically what you call as okay. So the importance of the flexible tip is that if at all it would have a stiff tip, then what's going to happen? It is going to kind of let's say cause an injury to the mucosa, or it might injure the ureter and it might kind of go out. Now you understand my point? So that is why what we use is a flexible like a guide wire with a flexible tip, which is basically called as a Teremo guide wire. Okay, don't know whether you have seen it or not. I'll try to kind of show it to you. That's fine. Okay, what else do you need? You need a RIRS sheath. You need a sheath. What is a sheath? I'll tell you. I'll show it to you. Just give me a minute. Then we need a RIRS scope. So after we have passed the sheath, we need a scope, right? We need a flexible scope in order to pass it through the kind of sheath and it would kind of enter till the kidney or something like that. Then we need a laser fiber, because once we are going to reach to the stone, we need to break the stone into the smaller pieces, right? So how do we kind of break the stone? In order to break the stone, we need to kind of use this this what you call as a laser fiber. Okay, so with the help of a laser, you can break the stone into the smaller pieces. That's what you need to do. Okay, then we need a stone holding forceps. So whatever the stone is broken down to the smaller pieces, now you can grab these particular stones and then you can bring it out. You understand my point? So these are the equipments which are needed for your what you call as a RIRS. So, in the chat, Vikesh is trying